His Excellency John Dramani Mahama Epa Free Health Primary Care no hontoma. Na we no wode abobo ya bi ema pomde adwuma efo nse nso wasen wo ndwumedi mu na dodo no a ensema wo kan dia fa honse no eba be ya ambulance na waba be yi ano.
I inaugurated the beginning of the free primary health care program, and we handed over equipment and some vehicles to the CHIPS compounds. We demonstrated what each CHIPS compound was going to get. There are more than 6,000 CHIPS compounds in Ghana, and we showed what they were going to get in terms of equipment and all that. Amongst the equipment we presented, there were motorcycles, but there are also tricycles. Let me be clear. I mean, if you don't understand something, ask. Don't jump to conclusion. Those tricycles are not ambulances. Those tricycles are meant for the health workers and the health volunteers to go from village to village for screening. That is what they are meant for. And so at the back of the tricycle, they have a compartment where they can keep vaccines. To keep the vaccines cool, it's at the back of the tricycle. In the north, a lot of our sisters who are health workers can ride motorcycles. And so when they go for health screening, they use motorcycles. In the south, many of the health workers cannot ride a motorcycle. But you need to give them a means of transport to be able to go and do the work you've given them. So in the southern parts where the health workers cannot ride motorcycles, they'll be given tricycles to go from village to village to do their work. In the north where they know how to ride motorcycles, the CHIPS compound will have a motorcycle. Our sister who's the nurse, she'll sit on it, she'll put equipment behind her and ride to the village and go and give them the attention they want. So let me emphasize again, those tricycles are not ambulances. I've seen a lot of people try to denigrate them and say that we're going to bring these as ambulances. They are not ambulances. They are vehicles for the health workers who are engaged in the primary health care program to go to the village, deliver vaccinations, and then also to do health screening, test people's high blood pressure to see if it's high, test their sugar level to see if they are developing diabetes. That is what those vehicles are meant for. And so I hope this will end all that arguments and things on the social media. Those tricycles, once again, are not ambulances. They are vehicles for the free primary health care volunteers to go around and do their work.